By the time that you watch this week's Freedom Minute, Congress may have already moved forward with its vote on Obamacare. They're doing this despite widespread public opposition and the prospect of huge losses in this year's midterm elections. Yet liberals on Capitol Hill seem to have decided to turn this into a suicide mission, and their target is 1/6 of the U.S. economy. From the day that President Obama took office, he has been intent on moving the country toward government-controlled health care. And he hasn't allowed anything to get in his way, even little things like double-digit unemployment or a public that's quickly abandoning him. In the process, the president and his allies have sacrificed both sound public policy and basic ethics. First, there was the slew of corrupt bargains intended to buy Senate votes for the health care bill back in December. Senator Mary Landrieu of Louisiana got $300 million for her state shortly before deciding to vote yes.
I make no apologies for leading this effort. I do not back up an inch.
We're sure that's a coincidence. Then, Senator Ben Nelson of Nebraska got his state permanently exempted from new Medicaid costs. When that one got out, it was so embarrassing that even Nelson began to oppose it. Now, a new round of backroom deals is accompanying the final push for passage. President Obama recently nominated Utah Congressman Jim Matheson's brother to the federal bench on the same day that he had Matheson over to the White House to secure his vote in favor of Obamacare. But Senator Robert Byrd of West Virginia, one of the upper chamber's kings of pork, may take the cake. He inserted a provision in the Senate bill allowing West Virginians to get money from a fund for coal miners suffering from black lung disease without having to even prove that they're sick. As if this wasn't bad enough on substance, Democrats are now showing that they can't even keep the process clean, despite the fact that they have an overwhelming majority in both houses of Congress. Though they had nearly a year to pass the bill, public opposition kept them from getting it done before the election of Scott Brown, which eliminated their ability to stop filibusters in the Senate. Now they're attempting to use reconciliation, a method only meant for budget issues, to ram the bill through. They've introduced a bill that's over 2,300 pages long, yet doesn't have anything to do with what they actually plan on enacting. And now they've devised a process by which they may not even actually have to vote on part of the plan. All this at a time when 73% of Americans believe that we should either restart this process from scratch or abandon healthcare reform altogether. Who can blame them? A year ago, we were told that this process would be the beginning of a more humane, enlightened America. But that's not the case. By now, it's becoming clear that the only thing comprehensive about healthcare reform is how corrupt it is. That's this week's Freedom Minute.